got to get permission ahead of time. Okay, there it's working now. I can see it. Okay. So you got to write a note every 50 when they're awake, but you could sleep 5 hours straight.
I have to wake up every 50 minutes for check-ins. The notes, I have to do notes. I have to do like an overall note, and then I have to do note for like the individual clients. It's 8 girls in a home. It's normally 2 of us in there. So me and my coworker, we just split it 4 and 4.
There's only 8 people. There's only 8 girls
in a home. Yeah,
that's so small. That's good. Y'all gotta worry about a whole bunch.
4-to-1 ratio.
Is it usually small? Group homes are usually small.
Yeah. 8 sounds big to me, but yeah.
8 is kind of big because there's other homes. Like it depends on what home they place you in. Because the home my friend is in, when I got her this job, I didn't get her the job. I just went to a block, and she put me as a reference or something like that. I get a sign-up bonus for her.
So how do you wake up every 50 minets though? You set an alarm? Or are you allowed to sleep through it and write a note from like 3 hours ago?
You get in trouble if you miss a check-in.
Oh.
So yeah.
Okay. Right.
Yeah, but I was new, so. And I didn't miss it. My coworker had the laptop. Like.
Oh. Right.
So
Okay.
technically, I never missed a check-in, but I was there when the check-in was missed.
What they say? Did you get in trouble like that? Or?
No, they were just like, you have to check in. Like this is for the state of Ohio, just for their insurance. Like you have to check in. It's a safety hazard if you're not doing your check-ins and all that good stuff. I just got a little.
They gotta make sure you alive and stuff like that.
Mm-hmm.
You alive and well.
So when you guys do your job, it's similar to that. So that sounds right. If we bill a 53-minute session, you write a note and then you get paid for the whole hour. So, and like on apparently growth therapy, I was making 60 an hour. My friend said they just raised it for 75 an hour.
An hour?
At growth therapy. So when you get your independent license, you can bill therapy and 60 an hour, 75 an hour, but it's with an independent license. That means MSW, LSW, 2 years after you practice and get licensed to get the independent license, then they hire you at that. And then you got to keep your own caseload. You got to keep your clients, it's easy to have no call, no shows all the time, Think about like here, how many times you guys seen a no call, no show in class?
Yeah.
So you got to keep, in a sense, you want to build a good rapport with the client, have goals you're working on that they created with you that they really want to show up and do. And sometimes the reason you lose them is because their copay is 25 or 50 an hour. So they're like, I don't know if I really want to pay for counseling. But other times you have a employee assistance program. So like Central State hires a company that pays and we get 5 free counseling sessions. So I don't have to pay that. And a lot of times they'll give you 50 an hour or 60 an hour. You don't have the copay in there, but it's still, if you're good and efficient, you can stack up 4, 5, 6, 7 clients in a day. If you wanted to. So behaviors that might lead to more intensive services. CPST is the community psychiatric supportive therapy. PH is partial hospitalization. Wraparound is like one step below residential, but evidence could be symptoms that interfere with school, social, vocational, educational, or psychological functioning and cannot be handled in a less restrictive setting, or if the child has a parent whose dysfunction or disability causes parent to be unable to meet the child's minimal mental health needs. And then a reason for additional service could be impairment of functioning must have occurred in the past 2 months or have a duration of at least 6 months in the child's life. Child is at risk for removal from the current living situation due to his or her emotional problems, and then cannot be maintained at the present placement due to their emotional problems. So you see they're intensive people. Yours almost sounds partial hospitalization.
Really?
Yeah.
Because it's like independent living.
Right.
They're free to do whatever they want. They have a nurse who comes in.
Do they have any mental health providers?
Not that come in. Like if somebody is like having a mental health crisis, it's like a list of numbers in the office you can call them. They have a Med MD number
Okay.
and everything listed in the office.
Okay. Are most of them like cerebral palsy,
Most of them are Down syndrome.
Down syndrome?
Like, I think five of the girls, is my mathematics? Yeah, 5 of the girls have Down syndrome and 3 of them have autism.
Some of them are very joyful though. Have you noticed that?
Yeah.
Like they're just happy.
Yeah.
They're happy with life.
Yeah.
For real.
And they love to color, like
Simple
like,
stuff.
yeah,
The
it's
simple
stuff
things
that
in
they
life.
can do. Yeah.
Like they're not in there looking at like nasty things on the internet or
Mhm.
like
They're
right.
like child-minded. Like,
Yeah, yeah,
They
yeah.
like to watch cartoons and color
Yep.
and like stuff like that.
There are also physical denotations that you notice. Is it like maybe you can see it in the tongue or the thumbs? Do you know what I'm talking about? That's what they say sometimes.
For my Down syndrome.
For Downs, trisomy 21, I think they call it.
My text, but
Most of it's like
I feel like you say
no. I see that with like my autistic clients. Like they do like she sits and she like do stuff like this and like yeah she can get her headphones on for like sensory.
So like flattened facial profile, upward slanting eyes,
Oh,
small
yeah.
head and ears, short neck, low muscle tone, hypotonia, and other
They're
common
all, like, really
features.
short, like, all-
Okay.
all-
Yeah.
Really?
Yeah.
Oh, that's not for me.
Right. Yeah. I mean, they're like I've done work with that population since 1991.
Yes.
On and off, obviously. Like that was my intro into social work when I got.
Like my job, it was like when I get my degree, I can move up to a different position.
Yeah. Oh yeah. You could probably be then like the supervisor. Is that what they're saying, or did they say something else?
I wouldn't be working in a home. Like it would be like a different job position.
Right. Okay. Well, you could probably provide case management, therapy. All right.
When
So
I look at my master's, like I'm just gonna change my position because it's a more higher paying position. I don't have to work there overnight. I can work lesser hours, more money. So that's what I'm gonna do when I go get my master's. Get a higher position with my bachelor's.
So when I talk about ethics and productivity, it goes both ways. So shoot, did it say my battery's low up there? It didn't. That's weird. They can overburden you and be like, you're so good at your job. I want you to see 2 extra clients. And you're like, but boss, I'm already billing 20 hours a week. Right. Are you and there's no setup when you're salaried, there's no setup for overtime pay. So it's like, are you going to reimburse me differently if I see 24 hours billable a week? And some of them have it in the contract, but that's the ethics on their side. So a lot of agencies, they years ago tried to push and say 24 hours a week minimum, or you don't keep your freaking job. And that was a little bit unethical as people saw signs of burnout. People were struggling with it. People were hating on it. So it sucked. But here's other reasons for additional services. I guess ethics of billables is sometimes people maybe have a personal life crisis going on and they say they saw all of their clients, but they only saw them all for an hour. However, they wrote the note for 2 hours. That's when you can lose your damn license. So that's ethically something that can come up. Or maybe they don't need as much services or they need more services. So I have 2 level of care scenarios. I know we're down to 9 minutes, but here's one. It'll make you guys think about it for a minute. And what would you do in this situation? It's Peter's a 6-year-old client who's diagnosed with ADHD. He's been with behavioral health services for 6 months and receives case management 2 times a week and therapy 2 times a week. He also sees the Lighthouse psychiatrist. I want to say a psychiatrist who has prescribed a stimulant. Which is at a therapeutic level and working successfully. He's reportedly doing well in school and is able to maintain attention to task. He has no suicidal, homicidal ideations. I hope not. He's 6 years old. And no oppositional or aggressive behaviors per parent and teacher report. He continues to struggle with being organized and with staying focused during transition times. Is this the appropriate level of care for Peter? What are your recommendations? So he's got case management 2 times a week and therapy 2 times a week.
That's a lot for a 6-year-old.
It is. And the board may come down hard on you like, dude, you're seeing this kid way too much. Like,
I think that's a lot to see a 6-year-old for ADHD.
right. And
if ADHD is the issue, because isn't that like
That's a
he's
attention deficit disorder.
yeah, he's 6.
yep.
You can't really tell how
Correct.
it's gonna affect him until he
Yep.
is. Yeah.
So you pass the ethics examination. Like, it's probably too many services, and you might want to at least go down to where it's 1 hour of therapy and the
I was gonna say therapy maybe once a week.
and 2 hours is the max of case management. So they're maxing out and doing way too much therapy. So they're going to choose you for audit if you don't have good justification as to why you're seeing them that much. Like, okay, last one.
For extra trauma.
Yeah, maybe if something came up and you could justify it in your note, like dad just died, that would certainly be enough to justify it, but it didn't say that in there. So here's a new one. Cheyenne is a 15-year-old African-American female who has a diagnosis of bipolar. She has recently opened with HBS for therapy and is being seen 1 hour per week. She has a history of cutting and suicidal ideation with attempts. She's been hospitalized 4 times in the past 18 months. Her last hospitalization was 3 months ago for trying to strangle herself with a belt. She's currently prescribed medication for mood stabilization and has an appointment to see the psychiatrist. She is verbally and physically aggressive towards her parents and siblings and has been suspended multiple times, like detention, trying to hurt, detained.
She needs to go to like a detention
Right.
center. Not a
Right.
detention center, but like a home for troubled kids.
And then here's another kicker. She's not an IEP. She's being told her next incident could lead to expulsion. Her parents fear they cannot keep themselves and the family safe. They called 2-for-1 Kids for help. She feels everyone else is the problem and she doesn't need services. Is that the appropriate services for Cheyenne? What are your
Add more
thoughts?
services for her. Shoot.
Yeah. Where does it say the numbers? I need to make sure I've got that on lock somewhere. Does it say?
Like therapy once a week.
Oh, yeah. Where does it say that?
The-
Where is that? Oh, there it is. I want to do the number 1 just so it stands out for me. 1 time hour per week. Okay. And then I don't like some of these in acronyms. I'm just going to say opened with BX services for therapy. Okay. She has a history that's HX. So they have all these in acronyms you'll have to get. Cutting, suicidal ideation, hospitalized 4 times in 18 months. Yeah. So yeah, you're right. Like you could even be called out for not giving her enough services. Like,
That's
dude,
what I was thinking. I'm like, oh,
you are responsible for her care. You guys didn't give her enough. So
she's been to the hospital already 4 different times.
mhm.
She's still. What can you do?
Oh,
Well,
hospitalized.
Yeah, she has been hospitalized. So like, I know that doesn't really do much for people, but make it worse. But I don't know what you can do in this situation. Maybe pray for her. Take her to church.
You can now. That is so because we have a separation of church and state. You have to be very cautious with that. So I like it. I like what you're saying. There are an agency that would be like, oh shit, you said church, and they could like come down hard on you. So if they bring it up, then you can entertain it, if that makes sense. But just out of cautious consideration, I love spirituality. I have 2 degrees in theology. I do that all the time. And I also want to cover my ass when I'm doing a job. So just being cautious, like we can assess and ask like, what is your spiritual beliefs? Are you interested in church? But we can't like force any of our ideology. So awesome thoughts and questions. Is there anything you guys think I'm missing? Like ethics for seeing client too much and not enough can come up at times. The productive number when not allocated properly could be an issue. So that's, I know that I'm not being very clear on that, but like, so some people are chasing the productive number. And at one of my old agencies, one dude was having personal problems. I don't even think he was seeing his clients, and he wrote up all these fake freaking notes that he saw everybody and billed the state for it. So that's where he just wrote bull crap. So you just got to watch for that, because there are, you could have a coworker and you get the client from them and they're like, yeah. And then you get to the client's house and they're like, I never saw them. So you may want to talk to them individually and